Thanks, Robin. Thanks to the organizers for having me back today. I was saying to Glenn, as we had a 2-minute prep before our session on products to make sure we're coordinating our talk, and we've got it all worked out now. So plenty of preparation in advance of that one. I was asked to talk a little bit about sort of managing the product culture in a post-takeover. For those you may recall, Genzyme was bought by Sanofi about 2 years ago now. And so the question is what's different? What's changed? What stayed the same? And then the question for this morning is, how do you manage your product culture post-takeover? So we're going to start with a test. I know it's not going to be just sit back and listen. You're going to have to work. So I want you to imagine and put yourself in the mindset of this company. You're a large company, a large multinational company with 120,000 employees. You have more than 170 products throughout the world. You have over 32 billion euros a year in sales at the time. And you're looking to buy a little company that has about 10,000 employees, 15 products or so, plus or minus, and about 3 billion in euros in sales. So the question to you is, what are you going to do with this company that you're going to buy? So are you going to absorb, assimilate, resistance is futile, just bring them right in as part of the team? Are you going to leave them totally separate, just, it's cute, we bought them, but, we're just going to have them generate some revenue through to our bottom line? You can do a bit of a mix. Maybe a reverse integration. Maybe we'll have the little guys sort of just run our big show, and we'll see how it goes with that. So you have your little audience response panels there, 1, 2, 3, 4, or A, B, C, D. So, all right. Interesting mix of answers out there. I'm not sure if there's any one right answer. Much of it depends. So what happened in the Genzyme world, it was kind of three, a mix of A and B. Genzyme is sort of, if you didn't figure it out, the little test was Sanofi and Genzyme. So the Genzyme had about 15 products. Number of the products rolled into the Sanofi perimeter properly, so it fit with their business unit. But some aspects didn't. Some components of what Genzyme did as being a niche company, very niche in its products and in its focus, basically had a different culture in how those products were managed and what they did. And so the challenge really comes down to is maintaining that product culture. If you see a presentation from Genzyme, every presentation from Genzyme will start with a slide like this. As a picture of a patient. And it'll be a different patient. This picture here is Sol. These are sort of new photo that we have there. This is a Pompeii patient of ours from Argentina. And this was during the photo shoot. She just happened to be coming from her ballet class. This one. We know our patients. Genzyme is, as all the companies we talk about being patient-centric, but we know their lives intimately because we are so niche in what we can do. The Pompeii treatment for this patient, for Sol, is keeping her alive. On that one, she is an enzyme deficient situation, but she needs this to continue to grow and to lead a normal life. So you'll see in that very niche focus, that individual focus, it doesn't fit well for what was the classic approach for a lot of large companies in dealing with their products. And so I'll give you another example of that, and so I'll come up with another test for you. So if I can jump to the next one. So I want to know what your opinion is on the number 169. So what's the significance of this one? Is it the natural number following 168 and preceding 170? Is it the length of the Thames River in miles in Ontario? Is it the atomic number for unhexanium? Is it the expectant replacement number for the Alfa Romeo 166? Or just nothing really? Well, the answer is all of the above. So you could be right, pick any of those. It is those. But to me, number 169 is something totally different. 169 is the number of patients that I treat. It's the number of patients that we look after in our rare disease. 169 patients in all of Canada across 4 of our enzyme treatments. They're there. We know them all. They know us. We're intimately involved with trying to help them in their care. It's kind of remarkable that you would think as you have a company looking after 169 patients across 4 products, 20 in one, we have 33 in another. We know Ian, we know Sandra, we know them all across there. It becomes part of how we deal with that. How do you look after 169 patients in a very large, huge infrastructure company? How do you manage 4 products for so few. And what we do in terms of our products is actually we don't spend a lot of time selling our products. Our products are available. We research up the yin-yang these diseases that no one else would research if the absence of our folks working in this space. We continue to research year after year in terms of understanding these diseases and the morphology of how it presents itself and the heterogeneity. All these patients are different. Everyone is different, and how they respond and how they deal with it and what their challenges are different. What's fascinating to us is we spend more time on the healthcare system than we do on our products. It's remarkable that you finally come up with a treatment that's going to make a profound difference in the lives of these patients, and you have a health system in our country that couldn't care less. Like, oh, that's a lot of work. Oh, they're going to need that follow-up, and they're going to need those infusions. We've seen patients that have been approved through the drug plans for reimbursement, but couldn't get treated in the hospital because the hospital didn't want to take them on. It's like, oh, it's a lot of work. We don't do that. And maybe you should wait. We spend time going around the area. We had a patient in Pickering that we couldn't treat locally. They were originally started at sick kids, and then they were 17 and a half, and they were just about to start infusion. They got delayed a bit, and they said, well, they're 18, so they're no longer us. So then the patient goes back to the Ajax Pickering Hospital, and they're like, well, we don't know how to do this either. We spent 2 years trying to find, and it wasn't until William Osler we found the cancer unit there that said, okay, we'll look after them. Brock's paid for it, it's just us. It stuns me that that's the amount of work that we do in terms of not just the product, but trying to deal with the treatment of these patients. It takes years for these patients to be properly diagnosed. I mean, these are rare diseases. Most of the docs you talk to may have heard of this during their med school days, but by and large, they don't. They don't think about it. It's not part of their diagnostic regimen. So how do you go about it? We have a disease, Pompe. You saw a picture of Sol up there. Pompe disease is extremely rare. As much as we might have 20 some odd patients across the country, it's remarkable that we don't have one patient from the city of Toronto. How is it that there isn't one patient in a city of 2.5 million people? What's wrong with this picture? Can't be. Patients are being missed. They're being misdiagnosed. We spend time, it's not just the product, but it's the care. These patients are going without diagnosis, without proper diagnosis, and without proper care or the opportunity for that, and what can we do for it? So if you think about products that are so niche and specialty, could Sanofi just roll that in directly into their standard sales force? It's different. It's a very different model. It's a very different model for our products, and because we deliver care, and it kind of freaked them out in the beginning. But now they understand it's like, this is a different approach, and we need to keep it separate. That's why you continue to see Genzyme, a Sanofi company. We are a division of Sanofi. We benefit from a lot of what Sanofi has to offer, but Sanofi also benefits for a special approach to some of these. And so let me give you a couple of lessons that we've picked up over time. So first, when that first integration happened and there was the change in the products, I think I heard this. I have only been at Genzyme for about a year, so I've heard a lot of that stuff that happened in the first year, but the message came out, and in any of these takeovers, in any of these changes, there's going to be some things you love and some things you'll hate. But the question that you're challenged with at the end is, notwithstanding that, for Genzyme, for our people here in our culture and how we deal with our healthcare environment and how we present and look after our patients is remember our purpose. Focus on the strategy, focus on the content. Don't get distracted by administration. Don't get distracted by processes and different approaches. Oh my God, I got to fill out new paperwork for this one, and I got to understand a different center to deal with it. It's not important. It's important for us as we think about it, as much as it may be a little bit complicated as we run our businesses, our challenges are nothing compared to the challenges of the patients we serve. Their lives are so much more affected by their diseases that the little bit of difficulty we might have trying to process something, trying to process a PO and dealing with the system, irrelevant, not important. Focus on what we're out there. But also remember that we're part of a large company. That's the beautiful thing for Genzyme, because it's being a small company in the past, you had limited resources. You had limited ability to really grow. You had to focus on that one. You only have a lot of patients worldwide even. But now we're part of a larger family and sister companies that we can leverage as well. We can use those capabilities and use those experiences and that scope. And now that's something as a company is, not only do you work in your business, but you start to realize there's a lot of good things that can happen in a large company. I guess a couple other things I would raise would be, it comes down to the individual. And as you guys all see change, we've had tremendous change in our environment. It's ironic, too, that as the message I told the staff is, oh, geez, there's a lot of change happening. It's like, good gracious. We as an industry by nature, are change. We want change. We're asking our physicians to change. We're trying to research change. We're trying to bring out products that change because we're not happy. All of us are not happy with the status quo. We're not happy with the care that's out there. We want everything changed, and so why shouldn't we change as well? And so how we respond and adapt to that one is going to say a lot about in terms of how we present ourselves out to our community. And then the last thing, too, as companies, we always need to remember is that even as the small ones, Sanofi spent $21 billion on Genzyme, and there was a reason for that. And so even though we're the small fish out there, the opportunity for us is that we do have influence. They want to learn as much as anything. They kept Genzyme as a brand for a purpose. Unique to the products and the nature of our business, but it's also, they kept it out there to realize that there may be some things that we can offer as well. And that's the challenge for us. So just to close, so my advertising for Genzyme with our photo of Jen and our MS patient from the US is, our mission is continually to focus on those unmet needs. Out there, see if we can make a difference. And then locally in Canada, all of us is just, how do we make a difference in healthcare? And by taking that approach to what is our products and what is our business, I think it's a good way, a good reason to survive that post-takeover transition. Thank you.